Hello, good morning everyone. We are now going live to showcase an Endo Lift procedure. So we're live from the clinic and I have a patient who I've already consulted. Her name is Anne and she's just on her way up. She's been at the clinic for about 15 minutes, half an hour or so. She's done all her consent forms, the paperwork. She has had her photos taken and she'll now just come up and join me. And what we'll do is I will just kind of give you a summary of the consultation in terms of why we're doing what we're doing. So welcome to all of you. It's great to see so many familiar names and a few not so familiar names. What I will say is that during this procedure, we'll begin by doing like a mini consult. I'll mark her out. I'll just explain to you guys why we're doing what we're doing, as I said. And then when I go over to the couch with our patient Anne, I'll hand you over to my assistant Sarah, who can take any questions and just shout them out at me. So there'll be a little bit of disruption as we move the camera, as we will need to do to go from here to over by the couch. Okay, here we are. So, Anne, come and join us. How are you? Good morning.
I'm fine, good morning.
Fantastic. Do come and have a seat, my love.
Thank you.
And just back in the way, Sarah, give us a wave. So that's Sarah who will be joining us today. So, Anne, I don't think we can see you. Can you just come on? There we go.
Hey.
Right, brilliant. Okay, so we have our lovely patient Anne here. And Anne, tell us how many years young you are.
57.
57, fantastic.
Yeah.
And tell me what's the primary thing that bothers you.
Sagging of the skin, lines and wrinkles.
Right. So we've had a chat, and one of the things that it would appear that bothers Anne the most is just, if I turn you this way, and I posted a little photo this morning, it's this area here. Now, this area here, some people refer to as jowling or blunting of the jawline, some facial sagging. There's various things that people refer to this. But if I get you just lean forward a little bit, so closer to the camera, let me just alter the angle slightly. If I turn Anne to the side, what we notice here is that if I pinch, there's just a little bit of excess. Now, what I'm pinching here is a combination of skin, superficial fat, and muscle. And if I move it, what I'm moving it on is bone and deep fat. So, what's important to understand is if we look at the anatomy here, okay, so if I just put this next to Anne's face like this, this is the deep compartment. This is the bone or the jawbone, and on the jawbone we have some deep fat. Now that doesn't move, but as we get older and our faces change, this compartment gets smaller. We lose a little bit of bone, we lose a bit of that deep fat, and therefore the support for the overlying tissue starts getting less. And the overlying tissue actually starts getting baggier because we lose elasticity of the skin and it becomes more lax. We accumulate a little bit of fat in the superficial, and finally the muscles can also become overactive. So often we have to do a multi-faceted approach. We have to replace the volume loss, and we can do that with soft tissue fillers, which we may do at a subsequent procedure. We can look at overactive muscles with Botox or botulinum toxin. She's already had that done. But today, what we're going to do is we're going to use the Endo Lift laser, which will do two things. It will tighten the skin, so it will give us a skin tightening in this direction. Well, we can't determine what direction, but we're going to be treating in this direction, I should say. And what we're hoping to do is tighten like this. But at the same time, we can use the laser to break down some of the excessive fat that's here. She doesn't have a lot, but if we can just start blunting that a little bit, what we start noticing is that the jawline will look smoother and more defined. So what I'm now going to do is I'm just going to mark Anne out with some pencil so you can see exactly what the treatment is meant to deliver. So, and what I'll do is I'll use these white pencils. You look straight at the camera for me. So this is the main extent of the fold here, and I appreciate that might not look very visible on the camera, so I'm just going to bring Anne a little bit closer in there. So this is the extent of the fold at the front, and then I can see that that is the main area that I want to target here. However, I have to be careful of a little nerve here, which does affect facial expression. and therefore I want to avoid using the laser in this region. And I also want to get some skin tightening, as I mentioned, so I'm going to be treating in this sort of area. So the idea is, in the posterior segment here, I want to get some tightening, but in the anterior here, I want to break down some of this excessive fat, and the net result should be a smoother and more sleek jawline. So I'm just going to mark Anne out on the other side of her face. And then once we've done that, I think we'll be good to take Anne over to the couch and actually begin our procedure. Now, Anne, before I begin, are there any questions from you?
How long does it take?
The procedure, right, we're going to start in about 5 minutes. The first thing we're going to do is give you some anesthetic. The anesthetic itself can just sting a little bit.
Okay.
And that will take about 5-10 minutes to administer the anesthetic. It's the similar thing that you'd have if you went to the dentist. And we use that so that when we pass the laser fiber, there's no discomfort. In fact, let me show you what a laser fiber looks like. When I did this on TV recently, a lot of people asked me if this was the same as a thread lift. It's not the same as a thread lift, because in a thread lift, the thread goes in and it stays there to pull the face up. I'm not a big fan of that procedure, I have to be honest. But this laser fiber, as you can see, it's very, very thin. It's sort of about against my top, you can see, it's slightly thicker than a human hair. And what will happen is, if I can just turn Anne this side, once we pop this laser fiber under the skin, we will transmit laser energy or light energy through the fiber, and that will heat up the tissue. So that will not only cause a bit of skin tightening, but it will break down the fat, as we mentioned. Now, that laser part of it will take about 15 or 20 minutes. Okay?
Yep.
We don't want to rush it, but it's not terribly long.
No,
so
okay.
we can take our time, and that's the whole point. Now, the other thing I want to do is just look from the side, and I notice that also we can also help you just under the neck, and we can start tightening some of the tissue just under the chin as well. So what I've done there is I've just marked off Anne under the chin here, because this will be another useful area just to give a little bit of tightening. Okay, what I'm going to do now is I'm going to hand you over to my lovely assistant Sarah, who can take any questions you have, because what I need to do at this point is just move the tripod so we get a good place to film from during the procedure. So Anne, if you'd just like to stand up for me,
okay,
and I'll take you over to the couch. Sarah, can I give you that? You, please meet lovely Sarah, everybody.
Hi everyone. I'm going to flip you guys around.
If you have any questions, you can fire them out now, just while we're moving ourselves into a better position.
So let's have a look.
Let's have a look.
Lots of people are here. Everyone says hi.
Highs.
Hello, Tapan. Lots of highs. So we'll turn it around again.
Okay. Thank you. Welcome back. So I'm just going to fix us here, and that should, I think, in theory, give us a pretty good position from which to see the procedure. Okay. Right. So stage 1 is all about using some anesthetic to numb up. We call this anesthetic lidocaine, and this technique is called tumescent. And what that means is that we're using a little bit more fluid in addition to the anesthetic, and the idea is that it just creates a layer that separates the skin and the fat from the tissue underneath, which is great for us because that's exactly where we want to pass our laser fiber. We'll pop that on after the anesthetic, Sarah. So we're going to begin just by numbing. So can I get something to clean? So, like all procedures, the most important thing is maintaining the sterility. So I'm going to give Anne's face a clean. Now, don't worry too much if you can't see at the moment, because we are going to change the camera position so we get nice and close in about 5 minutes. Because I know a lot of my team will be saying, you know, move the camera because we can't see anything. But once I've given the anesthetic, I will take the camera out of the tripod and we'll come up nice and close, so you get a really good idea of what we're doing. But this is just the anesthetic we're administering. Okay, so nice and still for me. Little scratch here, and well done. That's brilliant. Great. Now, Sarah, while I do this, are you able to just go closer to the phone and see if there are any questions from anybody? Little scratch. You're doing great. Now, a bit of a sting coming up now, Anne. And that sting will only last for a few little seconds, and then it's going to just calm down.
So a lot of people know, is this going to be able to be rewatched later on?
Yeah, so as with every single Insta Live I do, I'll save it onto the IGTV, and so you'll be able to watch it on there for sure.
A lot of people just saying hi.
Well, say hi back from me to everybody as well. It's great that you can join us. How are you feeling there, Anne?
Yeah, fine, thank you.
Good.
Someone wants to know, can you see results straight away?
No, absolutely not. So I think it's important to understand. Let's talk about this procedure and what we can expect. Anything that breaks down fat and is also giving us new sort of collagen regeneration is going to be a process that takes weeks. And I often will tell people that they shouldn't expect to really see much until probably the 3rd month following their treatment, which is quite a long time, and it's important to manage that expectation. In the same way, I had a chat with a colleague, and important to understand that this is not a no downtime procedure, but it's very minimal downtime, and there's a big difference. No downtime, I don't think really applies to almost anything we do in a clinic, because if you have a needle through the skin, you could get a little bruise, a little swelling, and that counts as downtime. But overall, the amount of downtime here is very, very minimal.
Another question then, how does this procedure differ in terms of results from the other tightening treatments like Ultraformer?
Great question. So I'm just going to carry on with the anesthetic while I answer that. Can I just give you this, Sarah? So, and I'll just take that back from you here. I just need a little swab here, please, as well. Okay, thank you. So, there's a lot of ways to tighten the skin. So we can use, there's that question asked, Ultraformer, there's radio frequency, there's lots of different skin tightening modalities. What's important to understand is that they all work in a different way, but their underlying goal is the same, and that's to basically induce new collagen. Now the thing about the Ultraformer, Ulthera, they're all called high intensity focused ultrasound. The thing about those devices, I really like them because they're almost no downtime. You could pretty much say there's no downtime because people may get a bit of swelling, but there's not much more than that. However, they do have limitations. And one of the limitations is that it's not terribly precise in terms of trying to do the two things that we're doing today. So with this procedure, I want to break down a little bit of fat, what we call laser lipolysis, and I want to tighten the skin. Now, when we try and do those same things with a HIFU machine, the important thing to understand is that with HIFU, we don't want to break the fat down. And in fact, that's something that people really worry about. Because with HIFU, if you break the fat down, it's more likely to be the deep fat, and that can actually make people look more gaunt or more drawn. So I love HIFU devices. I think they're really good for superficial skin tightening, and we use them all the time. And then there's also radio frequency. We can do radio frequency, which is a form of medical electricity. We can do this without needles or with needles, where the needles penetrate the skin. So again, it can be very minimal downtime or 2 or 3 days downtime. The nice thing about all of these treatments is that downtime is not terrible. 2 or 3 days of recovery, I think for most people is very manageable. And with radio frequency, the downtime is going to be more like recovering from a bit of sunburn. With the Ultraformer or the Ulthera, that downtime is just going to be swelling for a few hours. With this procedure, again, it's mainly swelling, which, speaking to the patient, seems to last anywhere from about 3 to 7 days, depending on how aggressive we do it. Because remember, with all these treatments, we can do different levels of intensity as well. Okay, that's one side done, in terms of the numbness. Now we do the other side. So, Anne, can I just get you to turn your face that way for me? That's brilliant. Just for about there. A little scratch.
Another question then was,
yeah.
How long will the results last?
That's a great question. Whoever asked that's a great question. And it's a question that comes up almost every time I do one of these sessions. But it's impossible to answer, and I'll tell you why. is because the results of the treatment will be whatever they are. But remember, at the same time, the person we're doing the treatment on is still undergoing normal aging process changes. So if you look at something like Botox, we can say that the results of the Botox last about 3, 4, 5 months, depending on the individual and the dose that we use. But that's because what we're doing is we're inactivating a muscle from working. Now, when we're doing this type of treatment, of course, we're tightening and we're, let's say, removing a little bit of fat. However, that person after the treatment may adopt a really healthy lifestyle, they may go, and maintain their weight very stable, or somebody could put on quite a lot of weight, in which case the results of the treatment are going to be very hard to determine. But if you had to talk about length of treatment, you're talking years rather than months, and I think that's probably the most accurate way I could describe it. So this is not something that you're looking to do every year, every couple of years even, but I think, maybe every 3-4 years or something like that.
I think you've answered a few questions there in one, so that's good.
Yeah.
I know a lot of people are asking us to move a little bit closer.
Oh, we will, don't worry. We're going to move closer. All I'm doing is administering anesthetic for now. And once I've done that, when I start the lasering, we'll get really close, so don't worry about that. Can they hear me okay?
Yeah, no one seems to be complaining about the sound. I just think, we know the camera's a bit far away. It's just the anaesthetic at the moment. So once we do the treatment, I'll bring the camera closer. So don't worry, guys.
Okay. Can I get that needle back again? In fact, what we can do for the last bit of the anaesthetic, you can probably unhook the camera and bring it back. So if I just get that needle, brilliant. Turn slightly this way. There we go. So that stand is probably as close as we can get. See if you can get it a little bit closer, Sarah, without the lead coming away.
I think that's
Or just literally, what you can do, unhook the camera, flip it so that it's not in selfie mode, if you know what I mean.
Yeah.
And then we can get really close. Be brutal, Sarah. There we go. That's it. She's so gentle, isn't she? Look at that. She's so careful with the phone. There we go. So now we
I'm
can
just going to flip so we don't
That's
see
it.
my face.
Now, can you see me? Come as close as you need to. Can you see that? So I'm just using this little cannula to numb the face. In all the areas that I want to treat. The area by the nose is a little bit more sensitive, and Anne's being absolutely wonderful here. She's not batting an eyelid, she's not flinching. Some people do find this part a little bit less comfortable. So worth saying that I think Anne is particularly brave, particularly stoic, which is great. Real trooper.
Do you provide training in this treatment for medics?
Right, so I personally don't, but my trainer, the person who trained me, who's absolutely fantastic, is a wonderful doctor called Dr. Priya Verma, and she really is.
She said good morning.
She said good morning,
yes.
So good morning, Priya, she's on the slide. She's fantastic. I know she's probably very busy, but the training that I got from her was probably amongst the best training I've ever had, and that's in a 20-year career. So I really do mean that. Training by Priya was absolutely fantastic. And look, this is not a promotional Instagram, okay? I'm just sharing with people what I like to do, what I believe in my treatment approach. So I have no incentive to promote one way or the other. But what I will say is that, used a lot of devices in the clinic. This particular device so far is proving to be very, very popular, both with me, but that's only because it's proving to be very popular with the patients as well. And the support I've had from the company and so forth is also fantastic. So all these things matter because sometimes, the device can be great, but it can, the support you get can leave a lot to be desired, or the training may not be so good. It can be difficult to get consumables, especially post-Brexit, coronavirus time. But we've managed to do pretty much everything we want to do very straightforward. Now, can you give me the phone for the last second, and then just do me up one more thing of anesthetic for the under the chin? So, any more questions? Very kind of you to say, Tapan. No, I mean it, Priya. It's credit where credit's due. It was fantastic training. Shilpa, is this bit painful? Look, the thing about anesthetic is, one of the ironies about local anesthetic is we give it to reduce pain, but having the anesthetic itself can be a little bit uncomfortable. It can be a bit stingy, but we're talking for a few seconds, okay? It's not uncomfortable for a minute. So as you first get the anesthetic going in, it will sting a little bit. If you've ever been to the dentist, you know what I'm talking about. But once that sting goes over, the rest of it is very straightforward. Yeah? Can this treatment be done if the patient has filler along the jawline? Look, it really depends on when the patient has the filler done. I wouldn't do it if the filler's like 3-6 months old. But more than that, I think it's okay. But remember that we can use this treatment to break filler down. So it's not a great idea to have this where existing filler's been done recently, because it will probably break it down. What first if we're planning Botox and fillers? Well, I would always do this before doing the fillers. Botox is fine. You can do Botox first. But, I would do the fillers after that. Right. I'm going to hand you back over to Sarah, because I just need to do the last bit of anesthetic, because we're doing under the chin. I'm going to stand up for this. So chin up for me, please, Anne. Little scratch again. There we go. Well done. Right. And take that away from me. Good. Sarah's managing to get all this on record. Brilliant. So you can see what I'm doing. And interestingly, the chin is a very well tolerated area. So I'm probably just getting a little bit of tightness here, and of that stinging that I spoke about.
What is the downtime of this treatment?
Downtime, look, it varies from person to person. Speaking to my patients that I've treated, some people had almost nothing the next day. Some people experienced swelling that lasted up to about a week. But what's interesting, swelling that they were aware of, but wasn't visible to other people necessarily. But it varies. I think 1 or 2 patients have reported some numbness, or what we call paresthesia, some altered sensation in the treatment area lasting up to a couple of weeks. Everybody's different. But by and large, of the treatments I've done, I would say 80% of people probably were pretty recovered from the procedure at about 3 days. Good. Okay, we'll let that settle. Can I give you that back? Right. Now, can I take the phone, and can you just do the drape for me? Okay, guys. So what I'm going to do is I'm going to hand Anne back over to Sarah, so we just get her ready for the laser bit, and I can answer your questions in that time, and then I'm going to glove up. Right. Does this tightening, so look, that's exactly why we're doing it. This is a tightening procedure. And you'll see this in a minute, why it's a tightening procedure, because it's heat underneath the skin. And, when I start, you'll hear a popping sound. And that popping sound is both the, little fat cells breaking down, but it's also the skin tightening at the same time. So somebody says, write the name of what? I don't understand. The procedure is Endo Lift, Endolift. Great. So, I think we're almost good to go. So, now what Sarah's doing, let me share this with you in real time so you can see. Where are we? There we go. So, Anne has now got a drape on. It just helps us keep everything nice and sterile. And we're just going to protect her eyes with a couple of soft tissue pads. There we go. What is the difference between this and face tight? That's a good question. So, face tight is a similar theory. It's a device made by a different company. But in face tight, it's radio frequency. This is laser. The second thing, with face type treatments, I think if I had to scale it, it's slightly more aggressive, meaning that you do the treatment, and most practitioners that I know will do some suction afterwards. Now, that suction to remove the fat means that it's probably more aggressive, so it's probably better for larger areas, but the downtime will be more, okay? I think probably more like a week. The cost of this treatment, it'll really depend on how much somebody's getting done, but anywhere from probably about £2,500 to £5,000, depending on how much area somebody has done. Right, let me hand you back over to Sarah, just while I get my gloves on and stuff. Sarah, as more questions come in, will you just let me know?
Absolutely. Is it good for the neck?
It can be excellent for the neck, depending on what the problem with the neck is. So, if the thing about the neck is, and people will often ask this, is it good for the neck? Well, I say, well, the neck is just a structure. Then we have to understand what's wrong with the neck. Is it skin laxity? Is it excess fat? Is it a lack of muscle tone? Is it all of the above? And remember that the underlying gold standard for most of these things is always going to be surgery, okay? So we're not ever trying to say that this is as good as a facelift, this is as good as a neck lift, because between you and me, it never will be. Surgery is surgery. It's always going to be the most guaranteed and consistent treatment that someone can have. Doesn't always mean it's going to be the best for an individual patient, because remember, sometimes people may not be a good candidate for surgery, they may have medical contraindications for surgery, surgery may be out of their budget, so ultimately the best treatment will really depend on patient to patient, why they're having it. Okay. Great. Now, can you for a second pop it back on the stand, because we're both going to need to put the laser fiber on together. So guys, we're just going to fix, just go back. There we go. That's it, give it the real thing, and then come over to me. There we go, excellent. Okay, so Sarah and I are just going to work together to get the machine started, and then once we've done that, we'll take the camera out so you're nice and close again. That's right. So what I'm doing at the moment is I'm just setting the parameters in the machine. And what I can adjust here is the amount of power that the machine is going to deliver. I can adjust the amount of time that the laser energy is on for. And I can also adjust what probe we're using. So we have different sizes of probes depending on which part of the face we're treating. Under the eyes, on the face, or this can also be used for the body as well. So, the fibers all come sterile, and then what I need to do is just fix it to the machine itself. And then I just test the integrity of the fibre, make sure it's all fine, and that looks absolutely perfect to me. Great. So we're close to starting. Just pop up a set of goggles on my head for me. That's great. And then you need a set of goggles as well. And then, if you want to rescue the phone, okay, we're back. Sorry, slight technical issue. Are we live? Yeah, looks
we are
like
live. Yeah,
we're live. Okay.
Sorry, everyone. That was my fault. You can tell I'm not technical.
Just kind of go slightly to the side for me. Okay, so the fiber's under the skin now, and what I'm going to do is I'm just going to gently advance it a little bit, and you can see that there's absolutely no discomfort. I can advance it under the skin, and with the audio you should be able to hear this popping. It's a little bit like popcorn.
Someone would like to know what wavelength this is.
It is a good question. I think it's about 1,500 odd.
It's 1590.
Don't ask me such technical questions first thing in the morning. I haven't had my coffee.
I think it's 1590, but don't quote me on that.
Endo Lift can answer that for us.
Endo Lift are on as well, they said hi. How does Anne feel? How are you feeling, Anne?
I feel absolutely fine.
Yeah?
Absolutely fine.
Yeah.
Good. And what
I
kind
can
of...
hear popping.
Yeah.
There's no pain at all.
Brilliant. And any sensation that you can feel, or just hearing
No,
the
I
popping?
can just hear like a popping sound.
Okay.
Good. Okay, now we're not going to ask Anne questions, only because as she opens and closes her mouth, it gets harder to actually do the laser passing, but I'm delighted that she's so comfortable. Any questions coming through, Sarah?
So someone would like to know, does this melt fat and can it melt fillers?
Okay, so obviously one of the issues we have with Insta-Live is people join at different times. So yeah, we've gone through it a few times that this is actually, what I'm doing now is this is laser lipolysis. This is melting the fat in this region. And these laser fibers are also used in many clinics to break down filler.
How many areas are good to do in one session?
It depends on the patient. It really depends on the patient and how extreme the areas are. But I'm very comfortable doing full face and neck in one session. Some areas you get a little bit of resistance, and you get the resistance because there can just be a bit of fibrosis, and that's fine, and over a period of time you don't struggle, you just pass it more fluently.
Melissa has said this is a great live and to tell you.
Okay, well thank you very much, Melissa. Melissa's always very kind. Any more questions, guys? So I'll do a little bit of talking as I'm treating. So what's important to understand is that in the face, it really is important to understand that there's fat in two different layers. As I said earlier when I was consulting with Anne at the desk, if we look at the anatomy of the face from superficial to deep, this top part, obviously we all know, is the skin. But just underneath that skin, there's a layer of superficial fat. Now, in many of us, as we age or as we put on weight even, we will accumulate and store fat in that superficial area. Now, sometimes that's okay, but sometimes we may not like that appearance. And that's that appearance that can give us a heaviness in the nasolabial fold, under the chin, what we call a double chin, in the jowl. And that's what's interesting is although that can improve with just diet and exercise, for many people it doesn't do, and it is quite resistant. Now below that fat there's muscle, and we can treat that with Botox, and that's the most mobile layer, that moves. What it moves on is the bone and the deep fat. Now that deep fat is quite precious, and we don't really want to lose that or do anything to compromise that. And that's why I really like this procedure, because it allows me to selectively target the fat that's disrupting the appearance of the jawline while preserving the deeper fat underneath that is important for the structure and the foundation of the face.
So a couple of people have just joined. They just would like a little bit of an overview of what treatment is, and is it jowls that you're treating exactly?
Yes. Okay, so guys, for friends and colleagues who are joining us lately, I'll give you a recap. So I have my lovely patient Anne here, and we're treating her predominantly in the lower face to improve skin tightening and also to just help with the jowl. I just need to have a look at the thing. There we go. Any more questions there, Sarah?
Can this be combined with treatments such as ultrasound?
Yeah, it's not unusual for me to, when I follow up patients, to then maybe have them on some ultrasound for maintenance, or, if somebody's got a lot of texture issues, we may give them some needling. So it can be combined with almost anything, and it's very rare that somebody's just going to have this treatment as a standalone. The other thing that this treatment can be used for is acne scarring, and I think it's going to be really useful for acne scarring patients. No other questions.
Is this better than filler?
Turn to me. So, I'm going to give you the answer to that by saying, if you have a toolbox and you say to your builder, is your hammer better than your screwdriver? Or is your saw better than your drill? Okay? They're two completely different treatments. You use filler to replace volume. You're using this to remove volume and tighten the skin. And I don't mind you asking that question, but it's so important to understand that sometimes people having their facial treatment may need 4 or 5 different treatments combined, because the different treatments target different things. I love my analogies.
Someone wants to know, would it be better to dissolve filler before and then refill after the treatment?
It depends where the filler is. If the filler is not good, or you don't like it, yeah, you dissolve it. But if it's already there and it's been there for some time, then it's okay just to do the treatment. You may need to add some more filler afterwards.
Can you combine this treatment with filler and threads? And can they be done in the same session or afterwards?
So I have done filler in the same session, but I don't like doing that. I'd rather do it later. I don't do threads.
And can this treatment be repeated?
Yeah, so, if somebody's got excessive heaviness and doesn't, but if somebody was, more bulky or the skin was more lax, what we might do is we might repeat it at 6 months, depending on the improvement after the first one. So we're coming up to the end of this side. Yeah?
Just for a couple of people that have just joined, they just want to know exactly what the fibre is. Is it a cannula or what kind of a device?
It's a flexible optical laser fibre. It's not a cannula. It's, when I take it out, I'll show you how flexible it is and how thin it is. So we're going to go for about 500 joules here.
I know a lot of people are asking about the patient, but we'll ask Anne before we move over to the other side. We're just going to keep everything nice and still for the moment.
How nice. They're worried about you, Anne. They're worried about you. There we go. Let me take that out. So, Anne, how are you feeling?
Absolutely fine. I can't feel a thing. I can feel a bit of pushing in and out, but there's no pain at all.
So, out of 10, what's your pain?
0, really.
0. Good. That's what we like to hear. 0 pain. And Anne has not been paid to say that.
No.
Okay.
No.
Right.
The most uncomfortable part is the anesthetic.
Anesthetic, of course, yeah. Which is the irony, right? That's the bit that we give you to, you don't feel pain, and that's the most difficult, that's the most painful part.
Yeah, you can hear a popping sound, but that's it.
Okay. Now, Sarah, can you just bring that, just careful it doesn't come out the back, the power cord, bring it forward, to about that, a bit more. There we go, that's fine. Okay, and what I'm going to get you to do is turn your face so you're facing away from me, sorry, the other way.
Okay.
That's perfect about that. Carry on, guys, more questions.
So one comment is that some patients can feel hardness under the chin after the Endo Lift. Can you clarify why this would be the case?
Yeah, I mean, it could be hematoma, that could be a bruise. Any procedure can cause a bit of swelling, and it could just be, I mean, I suspect if it's to do with the timelines, the kind of hardness that you feel in the first week, let's say, much more likely to be due to some sort of bruising process. And I think that's the most likely. Can't think it'd be anything else. Any other questions?
Just more questions regarding the results and how long it lasts.
Yeah? So what are the specific questions?
So how long do the results last?
Okay, I did answer that earlier, but I'll answer it again. It's almost impossible to say because things in the face are going to constantly change. But, you know, we're talking years rather than months, assuming somebody is consistent with their lifestyle after the treatment. And if somebody had this treatment, for instance, and then they went off, not, you know, now that the travel corridors are opening up again, and somebody went off to a fancy resort and they had a 1 month holiday, eat as much as you can, drink as much as you can, sitting by the pool, and they put on 10 kilos. Well, of course, you're not going to see the results of the treatment because the face is probably going to undergo some change. But assuming that you keep consistent, that, you know, your lifestyle doesn't change, you're probably talking years for the result here.
How much discomfort can be expected during the downtime?
None. Well, okay, no, that's too dramatic a response. Let me tell you, I can't ask Anne that because she hasn't experienced the downtime, but I can tell you based on the patients I've had. 1 or 2 patients did report a bit of discomfort for a few days, but interestingly, that was all when I treated the upper lip for upper lip lines. And, you know, both the ladies that I treated there, I did treat quite aggressively because their lines were pretty deep. What's interesting is in both cases, the lines have improved, like incredibly. And in fact, in my career, I would say the lines, the result I got in the upper lip region, which is quite difficult to treat, was as good as I've seen with anything. So bearing in mind that the results were really impressive, they were both very happy to have endured that discomfort. And it was discomfort, not pain. Most people find that the actual recovery is very straightforward. People may feel, as I mentioned, a bit of tightness. They may experience a little bit of a paresthesia, so that's like a strange sort of sensation, but that's quite unusual. Most people, fairly straightforward recoveries.
Would you say Endo Lift is the best option for skin tightening compared to other devices?
So I think in full transparency, I've been doing this for about 8 months now. Time goes fast. It just seems like the machine arrived yesterday. But yeah, it's about 8 months. And I don't think I've had long enough to really make that judgment. But out of everything that I've seen, it is definitely giving us very, very impressive and consistent skin tightening results. The one thing that I think probably gives better skin tightening alone is CO2 laser resurfacing. However, CO2 laser resurfacing also gives you a very, very, very significant downtime, could be up to 4 weeks, and quite a high risk of side effects, burns, pigmentation, scarring, etc. So it's very difficult to compare the two. And if somebody, let's say, had, you know, a lot of lines and wrinkles, I've seen some really nice results with, let's say, deep phenol peels and CO2. But we're really not comparing equivalent treatments here. This is a simple, pretty much walk-in, walk-out treatment. CO2 laser, for anyone who's had it, will tell you, is definitely not a walk-in, walk-out. It requires a fair bit of dedication to the course, and patients have to be very motivated to put up with the recovery.
Is this treatment suitable for all skin types?
Yeah, because remember, it's not treating the skin as such. It is a sub-skin treatment, what we call subdermal. Having said that, people with darker skins are going to be more prone to pigment change from a treatment that involves heat. But yeah, I'd have no qualms about treating patients of all skin types here.
Would this be a suitable treatment to treat nasolabial folds?
Yeah, and I'm going to explain why. Who's asked that question?
So that is from Neelam.
So Neelam, I'm going to answer that at the end if you don't mind. It's a great question, but I need to demonstrate something, so I can't answer it while I'm treating.
And just another question in regards to fat reduction. Does it do fat reduction as well as skin tightening?
Yeah, that's it. So it's got a twin mode of action. So what we're doing is we're using the light energy converting to heat as it's absorbed by the water in the tissue, and that heat is melting the fat and tightening the skin.
I'm not really sure what this question means. How much data would you need to give a proper assessment? I'm presuming that.
Oh yeah, look, I mean, the more the better, right? I mean, I can't give you a judgment after 1 patient or 5, but after 10, we start building a picture. But 50 is better than 10 and 100 is better than 50. So I will continue to report back every time I do it. But I think I'm already at about the 50 patient mark. So that's why I'm getting increasingly confident with saying the things that I'm saying.
This treatment is called the Endo Lift for anyone joining. There's a few questions still asking.
Okay, we're nearly finished on this side as well. And then we'll just do the area under the chin. What time is it, Sarah?
It is 10:46.
10:46, another 14 minutes. So yeah, we'll finish in about another 5 minutes, the actual treatment, and then I will just take some more questions on my end.
Can this be used for eyebrow lift?
No, well, look, people are doing that. I think we've got to be careful. I think if you're doing that, you probably want to go to someone very experienced in treating that delicate eye area. It is proving quite good for some of the swellings that we get in the under eye area, but I think it has been used, and I've seen colleagues around the world using it in the upper eyelid region. But I think you want to be very, very careful. That's a very delicate part of the facial anatomy.
A question from Angela. I had a facelift a few years back. Would I be a candidate for this treatment?
Well, having the facelift doesn't stop you from being a candidate. Whether you're a candidate or not is going to depend on what we see when we examine you. But yeah, I've treated a few people who've had facelifts. Technically, it's a little bit harder because you see how easily this cannula is moving in Anne's face. When people have had facelifts, the tissue is a little bit more fibrous and like scarred, so it doesn't move as easily. So that is now 1,000 joules, to show the monitor. So that means we've done 500 on each side. Now, Anne, can I get you to just put your chin up in the air for me? And we're just going to finish this off. Can you just kick the footstool just under? Give it to me a little bit, I can't reach it. There we go. Thank you. Thank you, Sarah. Can you just take the slack off this a little bit? If you just, yeah, keep going, the other way. That's it, as you're doing it. More, bit more. That's perfect. Yeah. And we can start filming this.
Are the nerves at risk during this treatment?
Yeah, can you highlight the area where I've drawn in the red? I mean, it's not very accurate, but just here. So there is a nerve there called the marginal mandibular nerve, which is a branch of the facial nerve, which supplies muscles to the lower part of the face, lip, and muscles around the lip. And if that nerve is damaged, it can lead to some smile asymmetries. And any procedure that you do along the jawline, be it filler, be it Botox, be it surgery, be it threads, can potentially compromise that nerve. And that's why I've made sure that I'm not going too close to that area with the laser fiber. Any other questions?
Not for the moment.
So we're nearly finished, actually. I'm really happy with how this has gone. Anne's nice and comfortable. Good.
Another question, what is the recovery time?
Okay, so something we've gone through a few times, but I'll keep answering because I am very mindful that people do join at different times. So, look, in Anne's case, I'm going to tell her that she should expect some swelling in this area for the first 1 to 3 days. Now, a lot of that swelling, interestingly, is simply due to the amount of fluid I put under the skin. So it's just time for that fluid to dissipate. I don't anticipate her having any bruising, but it's not out of the question. There could be, like I said, a little bit of discomfort in the treatment area, but 1 to 3 days in her case. But if at review she told me, it was a week, that's okay. Some patients have told me that as well. But that's pretty rare.
Another question in regards to if you've had silicone implants, would this be okay? So silicone implants to the jaw, would this treatment be okay?
I'd probably avoid it if there was actual true implants in that region, only because unless the person who put the implants in was doing the procedure, because the thing about implants is you'll be very careful they don't get infected. When you have an implant anywhere, whether it's the face, it's the breast, it's the knee, wherever you have an implant or a foreign body, you've got to be very careful that that implant doesn't get compromised. And if it gets infected, it can be a bit of a disaster. Right, let's ask Anne. Anne, we've finished. How are you feeling?
Absolutely fine.
Absolutely fine?
Comfortable, yeah. Virtually pain-free, just a bit of pulling and that's it, but no pain.
So are you still at that 0 out of 10 sensation?
Yeah.
Yeah? 0 out of 10. So I think that is important. And, we can see there's a very nice endpoint here. It's nice and firm. It's exactly what I look for at the end of the treatment. Now we're just giving her a gentle massage. And what I'm going to...
One thing I must ask, can I ride my horse tomorrow?
Can you ride your horse tomorrow? Well, how could we say no? You must ride your horse. I love patients getting back to normal activities soon after treatment. I think it's really important. So, yeah, I would love you to do that.
Okay, great.
So I'm just going to put a little bit of hyaluronic acid on her face. This is not filler hyaluronic acid. This is just something nice and hydrating. So this is not filler, okay? This is just a nice hydrating. So it allows me to massage. As I'm massaging, I'm just making sure that there's no discomfort, lumps or bumps or anything like that. That all looks really
Some
great.
questions in regards to before and after photos. Will Anne be willing to share before and after photos?
Why don't we ask Anne? Anne, would you be willing to share before and after photos?
Absolutely.
Absolutely,
Yep.
yes.
Problem.
No problem. Look at that. What more could we ask for? Now, let me just take her little eye protection off. Great. Let there be light, and there was light. Now, Anne, what I want you to do is slowly sit yourself up for me.
Okay.
And let me take your back there. Swing your legs around this way.
Okay.
And you can stay sitting on the couch.
Oh, okay. Yeah.
And let's point, so you come in so we can look at Anne. So you can see the swelling is not, it's not terrible. There is some swelling and we'd expect that because we've injected the fluid. But overall, the kind of look that you'd expect somebody to get if they'd kind of gone to the dentist or something like that. Yeah. Now, what time are we at?
We are at 10:54.
10:54. Okay, right. So let's go back to me. So Sarah, will you just help Anne get ready while I just take the last few questions? Guys, I'm back. So any more questions? So you see that, we started that live exactly at 10, which is when Anne walked in. It's at 54 minutes, we're all done. Okay, that's with the marking, the anesthetic, and the procedure itself. How long will it last? What treatment maintenance? So, how long it will last? Then we've answered that about 6 times now, I think. So I will do it for the last time. Look, it's impossible to say because the face is changing. Okay, we're all at different phases of the aging process. So from about 18 to about 35, 40, our faces may not show visible signs of aging much. After about 40, and at different times for different people, the faces can undergo quite dramatic change at different stages. So people may say that, didn't really notice something. One day I woke up and I felt 10 years older. And people talk about this. So there's different sort of phases of aging. So depending on where someone is, they can have the treatment, but the face is continuing to, undergo that change. But I think we talk about years rather than months. The gentle reminder for the nasolabial fold question. Yeah, the reason that was a great question is your question was, can you use it for the nasolabial fold? And I would say you should use it for the nasolabial fold. So look at me. Look, see this. This is what people complain about. Don't ask me why. This is a completely normal fold. We have it because if you smile, you need slack in the face for the mouth to push up against, and you're going to form a fold. And what people used to do in what I call the dark hole days of injecting is put filler in here. Looks crazy, okay? People look puffy, people look like that, scary. Instead, what we should be doing is that, okay? That, look at the fold, that takes it away. So if we start taking away a little bit of the heaviness and we tighten the skin, that would be, in my mind, the best way to get rid of a nasolabial fold. How does treatment differ from the Morpheus? Look, the Morpheus, the Secret RF, the Scarlet, the Intracell, the Infini, they are all radio frequency microneedling devices. That's needles going through the skin and putting radio frequency underneath it. The advantage of that type of treatment, I believe it's better for skin texture than this would be, but the amount of lifting we get here and also the fat breakdown, you're not going to get with those systems. Yeah, so we came up to the last 3-4 minutes. Any more questions, guys? So in terms of the aftercare, I'll tell Anne, I want her to just get on with her life. She wants to do whatever she can. She can have a normal diet today. She can eat whatever she wants. I like patients to stay well hydrated following this treatment. I believe it helps. Sarah is just helping Anne on with a little facial sling, which I'll just show you in a minute. Some patients, do wear these, some don't. I don't always give these out, but I think because I was quite, interestingly, and this is what I must tell you, I was actually quite aggressive with Anne's treatment. Sometimes I do it a little bit milder, but she tolerated it so well that I actually went quite aggressive. So if I just bring Anne back into shot, and we can see that she's got this little sling on, okay? So it's a facial support, just to support the tissue in the recovery. She's probably going to wear that for like 2 or 3 days, as and when she wants to. Marvellous session. Thanks to you and Anne. Anne, there's a lot of people sending their thanks. Thanks from me as well. Let me just let you receive those thanks. So thank you very much, Anne.
You're very welcome.
And of course, you're going to come back for a review when we do your photos and things. So yeah, we'll do another review with Anne, and when we do the review, I'll either do that as a live or I'll just pre-record the video and post it on my Instagram. Some more thank yous. When can we repeat the session? Look, I don't think she's going to need another one, but if she was going to have it, I'd wait at least 6 months. The thing about this treatment is she's going to get some visible results at 3 months, but it gets better and better and better over the next few months. And in fact, some of our expert colleagues from Italy who've been doing this for 15 years say they can still see improvements at 1 year. Okay, so we'll probably just keep reviewing Anne and seeing how she goes. Thank you for sharing this. Thank you. Well, thank you all. Thank you for participating. Okay, I'm going to sign off now. As always, I save the video for future watching on IGTV on my personal Instagram. So it's going to be goodbye from both of these lovely ladies. Goodbye from me, and we'll see you soon. Bye-bye.